Quick note, this is an automated educational summary of public medical sources, Mayo Clinic, the NIH, and Medline Plus. It is for tracking your health markers, not medical advice. Always confirm results with a licensed clinician. Quick disclaimer up front. This video is educational, not medical advice, and nothing in here replaces a conversation with your doctor. Here's what Mayo Clinic and the NIH actually say about magnesium deficiency. According to the NIH, magnesium is involved in over 300 enzyme reactions in the body, from muscle contraction to blood sugar control. And yet, Medline Plus notes that low magnesium often goes undiagnosed because the standard blood test only captures about 1% of the body's total magnesium. So you can feel symptoms long before a basic panel flags a problem. Let's break down what to actually look for and the specific tests worth asking about. Mayo Clinic lists the earliest signs of low magnesium as loss of appetite, nausea, fatigue, and general weakness. The Cleveland Clinic adds that many people first notice it as a vague feeling of being run down for no clear reason. Medline Plus describes the progression. Mild deficiency can simmer quietly for months because the body pulls magnesium out of bone and muscle to keep blood levels stable. That's part of why a single normal blood test doesn't rule it out. If you're chronically tired, despite sleeping enough, the NIH suggests magnesium status is one of several markers worth discussing with your clinician, alongside iron and vitamin D. This is the cluster people recognize most. The NIH describes muscle cramps, twitches, and tremors as classic signs of more advanced magnesium deficiency. Mayo Clinic notes that eyelid twitches, restless legs at night, and calf cramps that wake you up can all be linked to low magnesium, though many other things cause them too. The Cleveland Clinic flags numbness, tingling, and in severe cases, seizures. Now, a twitchy eyelid alone doesn't mean you're deficient. But if cramps, tingling, and fatigue are showing up together, Medline Plus suggests that pattern is worth raising with a doctor rather than self-treating with supplements. Here's where it gets serious. According to Mayo Clinic, severe magnesium deficiency can trigger abnormal heart rhythms, sometimes felt as palpitations or skipped beats. The NIH links low magnesium with higher blood pressure. In studies, an increased risk of cardiovascular events. On the mental side, the Cleveland Clinic notes associations between low magnesium and anxiety, irritability, and trouble sleeping. Research from the NIH suggests magnesium plays a role in regulating the stress response, though they're careful to say it's not a standalone treatment for anxiety or depression. The takeaway: if palpitations or new mood changes appear, that's a clinician conversation, not a supplement aisle decision. The NIH identifies several groups with higher risk of inadequate magnesium intake. People with type 2 diabetes, because high blood sugar increases urinary magnesium loss. People with Crohn's disease, celiac disease, or chronic diarrhea due to impaired absorption. Older adults, since absorption naturally declines with age. People with alcohol use disorder, and anyone taking long-term proton pump inhibitors like omeprazole. The FDA, cited by Medline Plus, has issued warnings about magnesium depletion with extended use. Diuretics for blood pressure can also deplete it. If you fall into any of these groups, Mayo Clinic suggests proactively checking magnesium status with your doctor rather than waiting for symptoms. The first test most doctors order is a serum magnesium test, a simple blood draw. Medline Plus lists the typical reference range as roughly 1.7 to 2.2 milligrams per deciliter, though labs vary slightly. Here's the catch the NIH emphasizes. Because the body tightly regulates blood magnesium, serum levels often look normal even when total body stores are low. So a normal result is reassuring but not definitive. Mayo Clinic notes this test is best paired with your symptoms and history, not read in isolation. If you ask for one, Ask the doctor to interpret it alongside the rest of your picture, not as a single yes or no answer. When the standard test isn't enough, the NIH describes two more sensitive options. The red blood cell magnesium test, or RBC magnesium, measures magnesium inside cells and reflects longer-term status, roughly the past 4 months. The other is a 24-hour urinary magnesium test, sometimes done after a magnesium load, which the Cleveland Clinic notes can reveal whether the body is excreting too much or holding on to it. These aren't routine. They're typically ordered when symptoms persist, despite normal serum results. Medline Plus stresses these tests should be ordered and interpreted by a clinician, since results depend heavily on diet, hydration, and medications in the days before testing. If you suspect low magnesium, the Cleveland Clinic suggests going into the appointment prepared. Bring a symptom log. When cramps happen, sleep quality, any palpitations, and how long it's been going on. List every medication and supplement, including proton pump inhibitors and diuretics, since the NIH flags both as common contributors. Ask specifically about serum magnesium as a starting point, and whether RBC magnesium makes sense given your history. Mayo Clinic also recommends asking about related markers, calcium, potassium, and vitamin D, because deficiencies often cluster. The goal isn't to self-diagnose, it's to walk in with enough detail that your doctor can order the right tests the first time. On the food side, the NIH lists the richest dietary sources as pumpkin seeds, chia seeds, almonds, spinach, cashews, black beans, and dark chocolate. The recommended daily intake from the NIH is roughly 400 milligrams for adult men and 310 for adult women, with small adjustments by age. A word of caution from Mayo Clinic: magnesium supplements can interact with antibiotics, blood pressure medications, and bisphosphonates, and very high doses can cause diarrhea or, rarely, dangerous heart and kidney effects in people with kidney disease. Medline Plus is clear. Supplementing without testing and without a clinician's input is not the right move, especially if you take other medications.